Today, over 1,400 infants will be born prematurely. That's 1 out of every 8 births. A lot of these premature babies will be too sick to go home, so they'll have to be rushed to the neonatal intensive care unit for life support and monitoring. Hi, my name is Alicia Carroll. I've been a respiratory therapist in the neonatal intensive care unit for 7 years. I have been working with God's tiniest miracles for all that time, and I have many stories of interesting facts to share with you today. In this speech, I'll review 3 main points. I'll let you know what problems are associated with premature delivery, why mothers go into labor early, and what preventable reasons occur for premature delivery. This is a picture of a 23-week baby, and that's the hand the mom's holding. So that's typical for what we see in the NICU for that small of a child. The smallest baby ever discharged from our NICU went home just this past month. She was just 331 grams. That's 12 ounces. Most of you guys can eat a steak that size. I'll call this little baby Baby K for privacy purposes. A baby this small has an increased risk for several lifelong problems. Number 1 is chronic lung disease. When a baby is born this small, their lungs are very immature, so sometimes you put a breathing tube in and give them a medicine in their lungs that makes it more elastic and easier to ventilate. They could also go on a ventilator. That's a breathing machine that breathes for them. The unfortunate thing about a ventilator is that it can cause chronic lung disease, but it also keeps the babies alive. Number 2 issue with babies being born premature is respiratory distress syndrome. As practitioners, we can recognize when a baby's in respiratory distress just by looking at them. They'll have nasal flaring, they will have retractions. That's when their chest will cave in and out with every breath. Or they will grunt to make it's a sound that sounds literally like grunting. It's their way of opening up their lungs, and it's an innate and automatic thing that babies do. IVH stands for inventricular hemorrhage. That's when there's bleeding in the brain. It can be anywhere from minor to severe. Grades 1 and 2 are very minor, and they usually resolve on their own. Grades 3 and 4 are pretty severe. Blood clots can form and cause a block of cerebral spinal fluid in the brain, and that can cause swelling, and it pushes on the brain, so they have to put a shunt in sometimes because the babies will have enlarged heads, and that way it will drain the fluid off of their brain. Blindness, it's also known as retinopathy of prematurity. The blood vessels in the baby's eyes are very immature and delicate, and with wide swings in oxygen, it can cause blindness in the babies. Profound deafness, some of the life-saving medications that we give the babies can cause them to become deaf. Necrotizing enterocolitis is a very serious condition for babies. When babies are born premature, everything is premature, including their little intestines, but they cannot live on IV fluids alone, so we have to feed them. And the food mixed with the bacteria of the intestines and with the oxygen that we can give them can cause a perforation of their bowel. It's very serious and it has to be treated surgically immediately or they could die. Why are babies born premature, and why do moms go into labor early? Number 1 is stress, either fetal or maternal. 2 is infections that moms can acquire. Anything from a urinary tract infection to periodontal disease can cause them to go into labor. PROM stands for premature rupture of the membranes. That's when the amniotic sac is ruptured prematurely and the baby can be delivered soon. It's an increased risk for infant mortality. Hypertension, this is the one that I see most often. The baby will cause the mother to have dangerously high blood pressure. She could have a seizure, go into a coma, or die from having high blood pressure that high. So if it's not brought down by medication or bed rest, they will have to deliver the baby early to save both the baby and the mother. And the last point that I'm making today is that sometimes babies are born prematurely because of preventable reasons. Drug and alcohol abuse and no prenatal care are the biggest reasons for premature delivery, preventable premature delivery. Over the years, I've seen more and more babies born addicted to drugs. These babies suffer and have to withdraw just like an adult does, except for they didn't make the conscious decision to do drugs. These infants shake, they scream in pain, they sweat, and they hurt very badly. We have a scale to measure their discomfort. It's called the neonatal abstinence score. It's where we can tell how bad the baby's withdrawing, so we can give them drugs to make them feel better, but they will have some issues later on in life as ADD and attention deficit disorder and attention hyperactivity disorder caused by the drugs that their mothers did. Nearly 4% of all women will abuse drugs while they're pregnant, anything from marijuana to heroin, cocaine, amphetamines, and prescription drugs. There are many health problems associated with these babies having drugs in their systems as fetuses, including all the things we went over at the beginning of the speech. because they'll be born small. Baby Kay was born too soon and her family did nothing wrong. Her mom's very healthy. She had good prenatal care. She had hypertension, that's why they had to deliver the baby to her so early. The baby Kay was lucky enough to survive, and it's really a true miracle. She does have some minor lung disease from being on the ventilator. She left the hospital with some oxygen dependency. Over 60% of babies born that small will have some chronic lung disease. Her eyes did exhibit pretty severe ROP, that's the blindness we talked about earlier, but they treated her with a new drug that they just trialed. It was a chemotherapy drug, and it actually cured her, and she left the hospital with no eye disease whatsoever. She went home with a capable, loving Christian home, they'll take incredible care of her. It was a real privilege to take care of this child. It's cases like these that make my job so rewarding. Thank you and for your time and attention.